Many patients with fibromyalgia ask me about supplements, vitamins, special diets, and if there are foods that they should avoid. Well, I searched the scientific literature and I found a few studies suggesting some nutritional interventions that could be helpful in people with fibromyalgia. So, let's talk about nutrition and fibromyalgia today. Fibromyalgia is a condition of diffuse pain persisting longer than 3 months, associated with depression, sleep disturbance, mental and physical fatigue. It affects more women than men and is present in about 1% of the general population. The pain is not directly attributable to a lesion, a disease, or an injury to the body, but the pain has features consistent with nociplastic pain. The first line of treatment includes non-drug treatments like education and self-management. The pharmacological treatment includes pregabalin, duloxetine, milnacipran, amitriptyline, cyclobenzaprine, and possibly tramadol. When we talk about nutrition, I will start with vitamins, minerals, and nutrients, and then we'll talk about things to remove, to eliminate from your diet. First, let's talk about vitamin D. It is known that 40% of people with fibromyalgia have deficiency of vitamin D. A natural source of vitamin D is our skin, which produces our own vitamin D when we are exposed to sunlight. In Canada, where the exposure to natural sunlight is rare, almost everyone here has deficiency of vitamin D. So, it is recommended that foods like milk, yogurt, and baby formula are fortified with vitamin D. I tell all of my patients with chronic pain to supplement with 1,000 international units of vitamin D per day. Doses higher than this can be toxic, as vitamin D promotes the absorption of calcium from the guts to the blood, and it may increase the calcium levels in the blood. What about vitamin C and E? Vitamin C and E are both antioxidants. Therefore, they are important to preserve the functions of neurons and muscles. However, there are no good quality studies to show if we should recommend supplementation or not. So, a healthy, balanced diet rich in citrus fruits and vegetables should be enough to supply all vitamin C and E that a person with fibromyalgia needs. The daily recommended intake of vitamin C is 90 milligrams for adults and 25 to 40 milligrams for children. Here are the best sources of vitamin C. Red pepper has 95 milligrams per half cup of sweet raw red pepper. 1 cup of orange juice contains 93 milligrams. 1 cup of grapefruit juice has 70 milligrams. Half cup of cooked broccoli has 51 milligrams. Half cup of cantaloupe has 30 milligrams. If you want to download this handout, it contains all of this information. Go to my website www.drandreafurlan.com/nutrition. The daily recommended intake of vitamin E is 15 milligrams for adults and 6 milligrams for children. Here are the best sources of vitamin E. 1 tablespoon of wheat germ oil has 20 milligrams. 1 ounce of dry roasted sunflower seeds has 7 milligrams. 1 ounce of dry roasted almonds has 7 milligrams. 1 tablespoon of safflower oil has 5 milligrams. 1 ounce of hazelnuts has 4 milligrams. 2 tablespoons of peanut butter has 2 milligrams. Half cup of boiled spinach has 2 milligrams. Half cup of boiled broccoli has 1 milligram. And 1 medium kiwi fruit has 1 milligram. Please remember, this video is not intended to provide medical advice. If you have chronic pain, please ask your doctor to make a proper diagnosis. This video is for educational purposes only. And if there is an emergency, please call an ambulance or go to the nearest emergency department. What about minerals? Magnesium is associated with muscle weakness and inflammation. There are no high-quality studies of magnesium for fibromyalgia, but it is suggested that people taking magnesium with amitriptyline was better than amitriptyline alone. Watch my other video about magnesium to learn more about the doses and where to find this mineral in food. Another mineral associated with muscle pain is iron. It is well known that deficiency of iron causes anemia and therefore fatigue and muscle pain. If the person is anemic, they need to investigate the cause of this anemia, and if they find that it is iron deficiency, then they will feel better with supplementation of iron. What about probiotics? It has been suggested that people with fibromyalgia has an altered microbiota, which basically is the composition of the bacteria in the guts. Therefore, supplementation of probiotics was done in a study, and it showed improvements in thinking and mental fatigue, but it did not show any difference in pain, quality of life, or mood. Extra virgin olive oil has many health benefits to anyone, but especially in people with fibromyalgia. They may benefit from a diet rich in EVOO compared to other kinds of oils. We talked about the nutrients to add, but what about nutrients to eliminate? Monosodium glutamate, MSG, and aspartame may act as excitatory neurotransmitters in the pain pathways. They activate the central sensitization and provoke amplification of the pain signals. Therefore, limiting MSG and aspartame, which is an artificial sweetener, are recommended. Some people may notice benefits by doing an elimination diet. They may try a period of gluten-free diet and observe if the symptoms improve: nausea, abdominal pain, fatigue, pain and mood disturbance. If the symptoms do not get better after a month, they may stop the elimination diet. Watch my other video about gluten and pain. The person may try a low FODMAP diet. These are fermented oligo-D monosaccharides and polyols that are poorly absorbed short-chain carbohydrates. They include lactose, free fructose, polyols, fructans, and galacto-oligosaccharides. This type of diet is useful to people with irritable bowel diseases or IBS. What about a low-calorie diet? A low-calorie diet is the most commonly used strategy to reduce body weight. It has been suggested that a reduction in body weight improves symptoms of pain and quality of life, and also improves sleep quality. If the person is obese, a more aggressive low-calorie diet for 16 weeks is recommended. What about other diets? Vegetarian diet is rich in fibers, vitamins, minerals, and antioxidants. There are some studies showing 3 months of a vegetarian diet helped to reduce pain and improve sleep. There are few studies using the Mediterranean diet for people with fibromyalgia, but the conclusions are conflicting. It seems that the Mediterranean diet plus supplements led to improvements in emotional processing, fatigue, and mood. In conclusion, it is very hard to conduct high-quality studies in the field of nutrition. We do not have firm conclusions about one diet, vitamins, or supplements. What we know is that a healthy diet provides all the necessary nutrients that a person needs. If the person consumes junk food or processed food, they will not feel hungry or motivated to seek healthy nutrition. Make a choice today to eat healthy. You are what you eat. Answer this question in the comments below. What nutritional change did you make that improved your pain, sleep, fatigue, or mood? Thank you for watching today. Bye!